Could that innocent-looking spot on your skin be a sign of cancer? Don't ignore these 10 silent warnings. Your life could depend on it. Number 1. New moles or changes in existing moles. Have you ever wondered why your skin suddenly gets a new mole? Or why an old mole starts to deform? These changes speak a lot about your underlying health issues, especially skin cancer. Skin cancer develops when there is uncontrolled growth of abnormal cells in the skin. This growth usually starts due to DNA damage in skin cells. The most common cause of this damage is ultraviolet radiation from the sun. Normally, cells repair DNA damage, but the repair mechanisms may fail if the damage is too severe or happens repeatedly. Well, there are different types of skin cancer, but melanoma is the most serious one. Melanoma is a type of skin cancer that develops from melanocytes. If you don't know, melanocytes are special cells that produce melanin. Melanoma appears as a new, unusual growth or a change in an existing mole. So, that means that if you are suddenly seeing new moles on your body that look like lumps, it's time to worry. Number 2. Unusual pigmented lesions. The biggest nightmare for a beauty-conscious person is to wake up with unexpected spots on your skin. But these mysterious spots are more than just a cosmetic concern. They are signs of something as horrible as cancer. First things first, what exactly is an unusual pigmented lesion? These lesions are areas of skin that have an abnormal color, mostly appearing as dark patches or spots that can be black, blue, brown, or even multicolored. So, how does cancer cause these peculiar spots? It all starts with the melanocytes, which are the cells that give color to your skin. They ensure that our skin tone remains consistent. In skin cancer, particularly melanoma, these cells become cancerous. They produce an excess of melanin or cluster together, creating dark, irregular patches. Number 3. Persistent pimples or sores. Next, let's talk about pimples and sores. We all get pimples at some point, right? They're annoying but usually harmless. However, if you have a pimple or sore that just won't heal, it could be a sign of basal cell carcinoma or squamous cell carcinoma. Basal cell carcinoma is the most common type of skin cancer and usually appears in sun-exposed areas like the face, neck, and arms. It starts in the basal cells, which are located in the outermost layer of your skin. These cells are responsible for producing new skin cells as old ones die off. When the DNA of basal cells gets damaged, mostly by ultraviolet, UV radiation from the sun, they start to grow uncontrollably. This unregulated growth leads to the formation of tumors that look like scaly patches. The reason these sores persist is that cancer cells invade and damage the skin's surface. As these cells multiply, they create open sores or ulcers that bleed, crust over, or become inflamed. The persistent nature of these sores is a result of the cancerous cells continually disrupting the normal healing process of the skin. These types of skin cancer look like a pimple, sore, or even a scab that bleeds, oozes, and then heals over before breaking open again. It's like that annoying friend who just won't take a hint and keeps coming back. If you have a sore that persists for weeks or months, it's time to see a dermatologist. Number 4. Dark streaks under nails. Here's one you might not expect. Dark streaks under your nails. A dark streak in your nails might be a bruise from hitting your nail, but it is also a sign of acral lentiginous melanoma, a rare type of melanoma that occurs under the nails, on the palms of the hands, or the soles of the feet. If you see a dark streak that doesn't go away or changes in appearance, don't just brush it off. It's worth getting it checked out. These dark streaks form when melanoma cells spread to the nail bed, the area underneath the nail. Melanoma is a type of skin cancer that begins in the pigment-producing cells called melanocytes. If these cells become cancerous, they attack various parts of the body, including the skin under the nails. As the cancerous cells spread, they cause a buildup of pigment, which creates the dark streaks. These streaks vary in color, from brown to black, and appear as single lines or multiple streaks. As the cancer progresses, the dark streaks become more prominent and also cause changes in the nail's shape or texture. The nail becomes thickened or distorted, and there might be associated pain or swelling around the nail area. Number 5. Scaly patches. Do you have a patch of skin that feels dry, rough, or scaly, even after moisturizing? Scaly patches on the skin are an important clue to skin cancer, particularly squamous cell carcinoma. These patches often appear rough, dry, and flaky, and they tend to show up on areas that have had a lot of sun exposure, like the face, hands, or arms. They might not seem like a big deal, but if left untreated, they can develop into skin cancer. These scaly patches form because of the way cancerous cells disrupt the normal layers of the skin. Skin cancer in the squamous cells causes them to grow abnormally. Squamous cells are found in the outer layer of the skin, and when they start multiplying uncontrollably, they create rough, thickened areas on the skin's surface. This abnormal growth leads to patches that look scaly or flaky. The texture of these patches is due to the buildup of dead skin cells and keratin. As the cancerous cells continue to grow, they cause the skin to become thicker and rougher. These patches usually start small but steadily grow larger over time. They may be itchy or sore and become inflamed. Sometimes they also develop a crusty appearance or even ulcerate, which means they might bleed or become open sores. Number 6. Pearly or waxy bumps. Another sign to watch for is pearly or waxy bumps on your skin. Running your fingers over your skin and discovering a small, shiny bump that looks like it's been polished. These bumps are mostly indicative of basal cell carcinoma, BCC, the most common form of skin cancer. So, what exactly causes these pearly or waxy bumps to appear? As you know, your cells also grow, divide, and shed in a regulated manner to maintain the health of your skin. But sometimes, these cells misbehave due to mutations in their DNA, mostly caused by prolonged exposure to UV radiation from the sun. Basal cell carcinoma usually starts in the basal cells, which are located in the lower part of the epidermis. These cells are responsible for producing new skin cells as old ones die off. When these basal cells start growing out of control, they form a tumor. If you are wondering, why do these bumps look so shiny? The answer lies in their composition. These bumps often contain tightly packed clusters of basal cells that reflect light, giving them a shiny or translucent appearance. Besides, these bumps are persistent and won't go away. Have you ever had a house guest who overstayed their welcome? These bumps are like that. They don't just appear and then disappear. They stick around, growing slowly over time. Number 7. Itchy or painful lesions. Itching is itself torture, but have you ever had an itch that just wouldn't quit? While most itchy spots are harmless, continuous itching or pain in a lesion is a sign of skin cancer. This is especially true if the lesion is new or has changed in appearance. It's like your skin is trying to send you a message, and it's important to listen. These sensations occur when skin cancer affects the skin's surface or deeper layers. As you know, when skin cancer cells grow uncontrollably, they form tumors that disrupt the normal skin structure. These tumors attack the skin's outer layer, creating lesions that become itchy or painful. This itching is usually a response to the irritation caused by the cancerous cells or the body's attempt to heal the affected area. The skin becomes inflamed, red, and tender, leading to the sensation of itching. Besides itching, these lesions also cause pain. This pain usually results from the growth and expansion of the cancerous cells. As the tumor grows, it exerts pressure on surrounding tissues, nerves, and blood vessels, which cause discomfort and pain. Also, if cancerous cells invade deeper into the skin or nearby structures, they damage nerves, contributing to a painful feeling. Number 8. Vision problems. Waking up one morning and realizing that your vision is a bit off, maybe there are dark spots, blurry areas, or strange flashes of light. You might think it's because of little sleep or need new glasses. But what if it's something more serious, like skin cancer affecting your eyes? Yes, that's right. Skin cancer also impacts your vision. How? Let's get into this. Vision problems in skin cancer arise due to different reasons, especially when the cancer involves or spreads to areas near the eyes. When skin cancer, such as melanoma, metastasizes, it spreads to other parts of the body, including the eyes. When cancer cells reach the eyes, they form tumors in or around the eye. The presence of tumors creates pressure on sensitive structures like the retina, optic nerve, or the eye's internal fluids. This pressure results in various vision problems, including blurred vision, decreased vision, or even loss of vision. Also, cancerous growths or lesions on the eyelids interfere with their normal function. The eyelids become swollen or disfigured, making it difficult to fully open or close them. This also leads to dryness, irritation, and discomfort in the eyes. This also causes pain and swelling that impacts vision. Number 9. Red swollen patches. Red swollen patches on your skin are more than just an irritation. At first, you might consider them as a reaction to something you ate or a new skincare product, but what if it's something more sinister like skin cancer? In skin cancer, these symptoms occur because your immune system is trying to fight the abnormal cells. When skin cells become cancerous, they form tumors. These tumors cause inflammation, which is the body's natural response to injury or infection. Inflammation acts as the immune system's way of sending extra help to a troubled area. This process results in redness and swelling as your body attempts to fight what it perceives as an attacker. Besides, your body's immune response makes things more complicated. When your immune system detects cancerous cells, it tries to contain the growth by creating a barrier of fibrous tissue around the tumor. This defensive action is called fibrosis. It involves the buildup of connective tissue, which adds to the redness and swelling. As the immune cells work hard to fight the cancerous cells, they release various chemicals, like cytokines. These chemicals make the inflammation worse and cause the affected area to look even more red and swollen. Number 10. Scar-like areas. Have you ever noticed a patch of skin that looks like a scar but you don't remember getting injured there? This is also a silent signal of skin cancer. These areas might be white, yellow, or waxy and feel tight or bound down. So, what causes these deceptive scar-like areas to form? Our skin is made up of different cells, including basal cells that are located in the outermost layer of the skin. These skin cells are builders, constantly repairing and renewing the structure of your skin. Normally, they follow a structural way to keep everything smooth. But when cancer appears, these cells go order and cause uncontrollable growth. This uncontrolled growth leads to the formation of scar-like areas, as the cancerous cells replace normal tissue with fibrous, scar-like tissue. These scar-like areas usually feel firm or attached to the tissues. The cancerous cells create a dense, fibrous tissue that makes the area feel more rigid compared to the surrounding skin. These scar-like areas are tricky and don't scream for attention because they usually don't show obvious signs of skin cancer like bleeding, crusting, or itching. As a result, they go unnoticed for longer periods, allowing the cancer to grow deeper and become more difficult to treat. We all know it, but excessive exposure to ultraviolet rays from the sun is one of the main factors of skin cancer. Protecting your skin is important, especially when the sun is at its peak. Use sunscreen, wear protective clothing, and avoid tanning beds to reduce your risk. Remember, early detection is key when it comes to treating any cancer. If you notice any of these signs, don't hesitate to see a dermatologist. It's always better to be safe than sorry. If you learned something new from this video, give it a thumbs up and share it with your friends to raise more awareness about the symptoms of cancer. Also, subscribe to our channel to see more health guides.